her nickname in high school was Calamity Jane. And she only discovered years later that it was one of her teachers who gave it to her. So I'm not sure what that implies. So everyone please welcome Ipek.
Good morning, everyone. I'm very happy to be here and to be sharing this work with you today that I recently completed, so it's fresh out of the oven. And before I begin, I'd like to acknowledge my collaborators on this work, Drs. Caceres, Jackman, Odlumbakken, and Ms. Suera at Columbia University. Okay. So I'm an associate research scientist at the Data Science Institute at Columbia University, and in my research, I focus a lot on physical activity and its subset of exercise as forms of symptom self-management across a wide range of chronic conditions. To this end, one of the questions that I investigate is how do we best leverage patient-generated physical activity data from various mobile health technologies to make better sense of them. These could include things like actively tracked patient data from smartphone apps, for example, as well as passively collected physical activity data from things like your Fitbit, your Apple Watch, so wearable trackers, activity trackers, which is what I'm going to focus on today. So one thing to know or to keep in mind with physical activity as a health behavior is that it is a longitudinal behavior that is meant to be done on a consistent basis, at least hopefully that's the goal. So when I am investigating physical activity, I want to know it is temporality, i.e. how this relationship might unfold over time for a given individual. Moreover, everyone has a unique relationship with physical activity, meaning this relationship might unfold differently for different individuals. So I also want to know in what ways these profiles, these trajectories might vary across individuals. But why should we care about these differences? Because knowing this, first and foremost, would allow us to design interventions and self-management strategies that are tailored at the right level, whether that is at the individual level or subgroup level. So it could be disease subtypes or different demographic groups, et cetera. Now, to further motivate this idea of studying the temporality of physical activity behavior, consider the physical activity guidelines. And you might have come across these at the doctor's office or at various online sources, which historically have focused on some sort of aggregated total sum. So you might have come across the quintessential 150 minutes of moderate to vigorous physical activity per week, right? Like to maintain good cardiovascular health or to get a certain number of steps each day, right? And these guidelines, even though they're useful to give us some sort of a benchmark, they do not give us any recommendations as to the timing of the activity. So does it matter that I distribute my activity throughout the day, or can I just accumulate all of the 150 minutes in one go in the morning and then sit the rest of the day? And more recent research is actually indicating that yes, indeed, it does matter when you do or whether or not you're distributing your activity. So if you are going to the gym in the morning, running for an hour, and then sitting for the remainder of the day, I'm sorry to let you know that you are canceling out all the health benefits you are conferring in the morning. So the more recent, you might actually have seen these phrases, break your sedentary time, so like get up every hour, walk around. So like this is where those recommendations are coming from. So we're finding out that it is actually, instead of focusing on getting this higher intensity accumulated in at least 10-minute bouts, that if we just focus on getting any activity, so any intensity, could be light, but more frequently distributed across the time course, it might be more beneficial. Okay, now let's convert this research question into a data question. What I'm trying to figure out is, can I identify homogeneous latent profiles of physical activity trajectories, or clusters, or groups, in samples that are interpretable, actionable, potentially clinically relevant, and that are detectable even in mixed samples of patients so that the results are generalizable, right? And of course, there's a whole plethora of clustering methods out there that are commonly used and have been published on in the literature. However, existing physical activity clustering studies have typically aggregated physical activity data at some level, either at the day level or week level, in which case the unit of analysis in these studies is a scalar. It's individual data points, even if it's aggregated, even if it's an aggregate of various time points. So how do we build a model where the unit of analysis is an entire curve of data points instead, right? The whole trajectory. Okay. Enter package FunFem. So one way to address this question is to use a clustering method that relies on what are called discriminative functional mixture models, which the FunFem package allows us to do. So this is a probabilistic clustering technique, so it's doing self-clustering. And what the model does is that it models a set of observed curves or individuals into k homogeneous groups or clusters based on their similarity. So some sort of a common functional subspace, as they're called. So in these models, the FMMs are a part of the larger family of functional data analytic methods. What makes them unique is that they consider the unit of analysis is a curve, an entire path of discrete observations data points. So it's the whole curve is one unit of analysis. And therefore, they allow you to consider the whole temporal aspect of whatever variable you're interested in studying. So as you can see, this makes them particularly useful in this case scenario with this question that I'm trying to answer. Okay. And FFMs further, they have parsimony in that they allow you to distinguish between these trajectories without requiring an extensive set of variables. So you can cluster in a single variable because the added temporal dimension, the time dimension, actually increases the number of predictors because you're clustering on that many time points. Okay, so let me tell you a little bit about the study sample and the data source. So I'm working with a sample of 133 adults. Ages across the lifespan, so it's a pretty wide range. And with respect to health status, there's a little bit of a variability there too. These were all individuals enrolled into a study at the School of Nursing at Columbia University by my collaborators that I listed in the beginning of my talk that aim to study health disparities in Latinx adults with certain various comorbidities. So I have, for example, older adults who are living with HIV. I might have younger, physically healthy adults who might have some psychological stress-related symptoms, but otherwise physically healthy, and so forth. And a lot of them are at increased risk for some sort of a sleep disturbance, for example, but not necessarily a clinical sleep disorder. Okay, so they're not all healthy young adults. For physical activity data, I'm using Active Life Actigraph devices. These are research-grade, wrist-worn activity trackers. They provide a whole range of variables for use. For interpretability and relevance, I focus on steps. So sedentary minutes, that would be sitting, low metabolic activities when you're awake. So sitting, standing, and so forth, as well as different intensities of activity. So light intensity, that would be a leisurely walk in the park. Moderate intensity would be a brisk walk on the sidewalk that we at least see in New York. Vigorous intensity would be running to catch the bus as it's leaving the bus stop. And then very vigorous intensity would be sprinting to catch the subway as the door is closing because the next subway does not arrive for another 7 minutes. Okay? Okay, so those are my variables. Okay, so the first step when we're dealing with functional data is to reconstruct this sample path of observations, discrete observations or data points into some functional form. That's where the name comes from. So this FunFem algorithm assumes that the sample paths belong to a finite dimensional space spanned by some basis functions. And basis functions are used to, or a simpler way of saying this is we use basis functions to basically smooth and synthesize the trend in each path, each curve. So then it becomes, so then one curve becomes one unit of analysis, each individual represented by a curve. Okay. And the complete observational time period, you can divide into subintervals, so you can specify at what points how much curvature you want. So this is the exact same idea as when you're smoothing in other models. Right, you have to pick the right balance between over-smoothing and under-smoothing, how much wiggliness you want, right? So you don't want to over-smooth so that you're missing out on potentially important trends, but then you don't want to under-smooth, then you're picking up noise that's not really a meaningful trend. Okay, so these subintervals in this case are called bases, and then the breakpoints are knots. So the purpose of our analysis, what do the data look like? So each individual is represented by 24 data points, each representing 1 hour. So I'm using 24-hour data from everyone for each individual. The smoothing functions and the number of knots that provide the best fit for the data are picked based on, by trying different models and then using the BIC index to pick the model that provides the best fit for the data. BIC index is what's recommended specifically for this model. And then the cluster separation, the goodness of fit, and the validation of the separation of the clusters are done by, the splines. So the most commonly used basis functions in this scenario are the B-splines and the Fourier functions. So those are what I tried, and I tried up to 12 knots and K of 2 to 6 clusters. Okay. So once you try different models, and I go through the typical pipeline of using both visual inspection of the basis plots to make sure that the functional space separation is actually separate and that there is no overlap, as well as some post-hoc tests to make sure that there are actually statistically significant differences in patterns. Okay. And then I looked at some day-level summaries as well to see how it compares when we aggregate versus look at the trajectories. Okay. So the results of the models indicated 4 distinct homogeneous physical activity phenotypes, and moderate intensity activity provided the best separation between clusters. I should also mention that in the sample, nobody had any vigorous or very vigorous intensity activity. So any activity they had was either of light or moderate intensity. So nobody is running to catch the bus or the subway. Okay. So, and this is the, right, so this plot is the orientation of the functions, the orientation of the coefficients according to the basis functions. Okay. So this figure shows a 24-hour trajectories for each of the identified phenotypes. To provide a visual description for each of them, phenotype 1 was characterized by an initial increase in activity levels in earlier times of the day, so around late morning, followed by a gradual decline in activity over the remainder of the day. So these individuals, you can think of this as the typical 9-to-5 working professional archetype, like they're more active in the earlier times of the day, they're working, and then they come back and they kind of just sit around until bedtime. Phenotype 2 was and phenotype 1 was the largest of the clusters. Phenotype 2 is the smallest, and these are also the most active, most likely to be the most active out of all the phenotypes. They have the highest levels of all types of physical activity and the least amount of sedentary time. And compared to phenotype 2, they were more likely to have later bedtimes. Okay. Now, phenotype 3 is the most sedentary phenotype. It was characterized by just very little amounts of activity throughout the day, and mostly being sedentary. And the age associated with this group was also slightly older than the others. Okay, so phenotype 4 is distinctly characterized by a more evenly distributed activity level throughout the day, and as well a shift in circadian patterns. So these people were more likely to wake up later and also go to bed later. Okay. Now let's put these numbers into perspective. And we can do this by using published cutoff values for steps and different intensities of activities and some proposed activity zones, but these proposed activity zones are just for provide some intuitive description. They're not clinically defined. They're not very strict zones, so don't think of them as like a clinical diagnosis or anything. So based on these provided cutoffs, phenotype 1 would consist of individuals who are active or somewhat active based on that 10K steps per day cutoff, right? So it's a mix of individuals. On the other hand, phenotype 2 and 4 would represent highly active individuals and most likely to accumulate the recommended weekly dose of moderate to vigorous physical activity. They're accumulating quite over the recommended dose of 150 minutes. In contrast, phenotype 3 would fall into, or membership to phenotype 3 would fall in the categories of sedentary or low active, and most likely to not meet the recommended physical activity guidelines or step counts. And so this group would be associated or is associated with the highest risk of experiencing the adverse effects of being physically inactive. Okay. And as I mentioned, the age was a little older for this phenotype, and that's in line with the literature suggesting that the physical activity levels actually decline over the course of the lifespan. So that's not too surprising. Okay. So I'll mention another interesting point. So consider phenotypes 1, 2, 4, right, the non-sedentary groups. When you look at the aggregated sedentary minutes, they're actually somewhat comparable for these 3 phenotypes. And remember that I said in the earlier slide that phenotypes 2 and 4 are most likely to accumulate the higher levels of at least moderate intensity activity. This means that phenotype 1 is getting more light intensity activity. Now, why is this interesting? So as I mentioned, the physical activity guidelines are now slowly shifting, that there's more focus on not just the higher intensities, but rather any type of activity, even light intensity, to replace sedentary minutes. And so this is kind of exciting. Why? Because if you are working with an older adult or someone who's coming from an injury and you want to make a physical activity recommendation, you don't have to force them to do higher intensities of activity. You can still prescribe lighter intensities of activity, and this person can still confer the health benefits of being physically active without overexerting. And because they will likely feel higher levels of self-efficacy about doing light intensity activity, they're more likely to adopt, more likely to maintain this behavior, and more likely to then experience the benefits. Okay. So some takeaway points. In this work, we use a functional data analytic approach, specifically functional mixture models, to identify interpretable, potentially clinically meaningful clusters of daily physical activity trajectories in a mixed sample of adults over the ages over the lifespan. Our models identify 4 phenotypes, which have been alluded to some extent in the literature. So we have some confidence to say that these are not completely out there imaginary archetypes, that they do exist out there in the population. And identification of such phenotypes constitutes the first step towards designing interventions that are more efficacious and that can be tailored at the right level, whether that is at the individual level or subgroup level, or in any other aspect, okay? So that we can more adequately address these behaviors. And with that, I'd like to thank you for listening and remind you to break your sedentary time during the conference by walking around. You can reach out to me if you have any questions. I'll be around in the break, and you can connect with me via social media or email. So, thank you.